The types of stroke of Swedish massage. Presented by host Julie Mary JB Bayat of YG.ent. First is what is Swedish massage. Swedish massage is a very traditional and highly requested form of massage, often used to facilitate relaxation by eliminating everyday tension held in our bodies. The medium we are going to use for the activity is the massage oil. For doing the activities, we need to sanitize first our hands for the safety. There are 5 basic types of stroke in Swedish massage. This can be in any order depending on what is best for the client's needs. First, efferage is more long sliding, gliding, and sitting strokes with the use of forearms and relatively slow and smoothing strokes used for spreading oil. An efferage movement is usually repeated several times to induce relaxation of muscle. We apply a large massage stroke to the back of the leg to touch and to warm the muscles. Then I go my hands pointing into opposite direction. So hands together and the way up, then we move the hands around, lifting the tissue slightly as we come back down towards the foot. And we're trying to cover as much of the muscle tissue in the leg as possible. We're going to press down gently as I go over the back of the knee. I'm reducing pressure and then I go over the hamstring muscle groups. I'm applying pressure again. We've got pressure on over the gastrocnemius and soleus. Reducing pressure over the back of the knee and then pressure again as we go over the hamstrings. I'm separating the hands as I come down the leg so the pressure is working in the direction of the lymphatic flow and also in the direction of the circulatory system as well. Second is massage. Petri, which means to knead. This technique is like kneading a dough. So kneading, rolling, and squeezing strokes stimulates the nerve endings, getting rid of impure substance in the muscle and increase circulation. This then will promote cell repair. In massage technique, we apply the reinforced kneading, alternating hand kneading, wringing, rolling, and compressions. This technique helps in increasing blood circulation, increasing tissue elasticity, waste products from the muscles. We perform it to stimulate the skin surface and encourages vascular and lymphatic response. Vibration is an oscillatory movement that shake and vibrates the body. This movement can be done rapidly or slowly. Vibration technique reduces tension in the muscles being performed. vibrations, tremor-like movements of the palms and fingertips against the body part, causing it to vibrate may be fine or coarse depending on the degree of movement, rate of vibration, and pressure. May be static, staying in one place, or running, moving into different locations. Indications for fine vibrations are going to be pain relief in acute muscle spasm, cutaneous inflammation, coarse vibration may be used for flaccid or atrophied tissues, atonic constipation, or chronic pulmonary diseases. The key in the application. Fourth is friction. This technique can be done by rubbing back and forth. The movement creates heat, warming up muscles in the body to be treated for deep massage technique. We are doing the extensor digitorium. This is on the anterior aspect of the box of our lateral epicondyle, so this time we're going to use our thumbs to come in and going to be more in front of the patient. So I come in, I'm going to use one thumb reinforced by the other going to push up into the lateral condyle, sweep across and release again. I'm still maintaining contact with the skin but I'm releasing on the return. So I compress, sweep, release in a slow rhythmic motion. The rhythmic stretching is to be able to help those collagen fibers line up along the lines of stress to improve their tensile loading ability. Tapping, pounding, and patting of the body. The motion is like drumming. Reproduce should be your hands by cupping, hacking, and chopping. This technique is usually used as the last technique in a massage session. The technique is called cupping, so we need to cup our hands and trap air underneath our hands. You'll notice that I incorporate this technique this time in the upper thoracic area. This technique is good for chronic conditions like bronchitis.